Time for Experts on Call on AM 800. Get ready to phone in for free information and advice from today's guest, who's an expert in their field. Experts on Call is a paid commercial program on the #1 station in Windsor, Essex, AM 800 CKLW, the information station.
Welcome back to Experts on Call. It's 12:07 with Kara Rowe. This is hour 4 of Experts on Call, and I'm sure you guys have heard me on this show before. This is one of my favorite hours because I am a patient of Dr. Schisler, and he is joining us today. And I get really excited because he completely fixed my back. And so for those of you out there, and I'm really passionate about this subject as well because I lived in back pain, basically couldn't walk for 2 years. So to go from that to now I'm in the gym 3 hours a day training to get my title back, that I had to vacate, having a back injury. It's pretty amazing stuff. Dr. Craig Schisler from the Schisler Spine Center is here to talk to you about people that are dealing with severe neck, back, sciatica, and disc pain. He does have the new medical breakthrough, the only one in Windsor, Essex County. It's called the DRX 9000. We're going to learn all about that. I know there's so many of you out there that are completely frustrated. You're at your end of your rope and just said, you know what, I can't do this anymore. Obviously, this is the way I have to live. Well, Dr. Schisler is here to tell you this is not how you have to live. This is not something that you just accept. There are other options out there. And I know there are people out there that have done everything, maybe physio, chiro, acupuncture, even gone to surgery and still don't have good results, are still living in pain. And this can help you out as well. At the Schisler Spine Center, they do offer a free test, a free evaluation. It is a $250 value. You can see if you're a candidate for the DRX 9000. You can give them a call at 519-988-0220. That's 519-988-0220. And also joining Dr. Schisler today, Don, one of his patients as well, will talk about his experience. And we're going to touch upon something different. We quite often talk about pain, but we're also going to talk about how you mentally and emotionally change after this experience and going through this and starting to have some relief. So welcome to the show, gentlemen, after that huge introduction.
Thank you, Kara. Good morning.
Yeah, well, as you know, I look forward to this hour with you, Dr. Schisler, because I want to get the word out as well that there is help. There's help and there's hope for people out there suffering. And talk to me a little bit about the DRX 9000.
Okay, well, let me start with a question here. What if, contrary to popular belief, as you aged, things didn't get worse? You didn't fall apart physically, and pain was not part of that equation. What if pain and suffering were not even an option? That's pretty exciting stuff. Well, one of the big things that we deal with is back pain. But let's take it a little further. Let's look at severe back pain. Pain from herniated discs, from bulging discs, things like sciatica or carpal tunnel syndrome. These are things that, well, traditionally haven't had great results with surgeries. A lot of people have these and are put on drugs that only mask the symptoms, and you gradually get worse and worse and worse because it doesn't fix it. Well, what the DRX does is it addresses all these problems and changes them and puts you back to where you should be, and allows you to, hey, get back on track and live your life again the way you always wanted to.
And how is it that something like this can do this when, maybe Dawn has as well, we tried, physio and chiro, we've tried all these different things, looked at all these options. How is it that the spinal decompression of the DRX 9000 can accomplish this?
Well, magic. No, that's not true. Science. This machine, what it does, basically, I'm going to give you a real brief version, is it addresses the damaged discs that are bulged or herniated in your back. And what happens when they're bulged and herniated is they push out and they pinch nerves. So what this does is it addresses those discs specifically and sucks the disc back away from the nerve, freeing it up, which takes away the pain. But here's the exciting part. At the same time, it rehydrates and rebuilds the discs, so we end up with very stable platforms.
Now, and one thing I want to talk about are the discs themselves, because that's the one thing I did learn going through the Schisler Spine program. Mm-hmm. is that they actually have a pumping, almost like a heartbeat in the disc as well. And tell us about that, because that's when it finally came clear why this actually works. And that's where the clarity came for me.
Yeah, the discs are like mini pumps. And they're set between the bones of your spine, and those bones are called vertebrae. Most people understand that the discs are like shock absorbers, but they don't really know how they work. Well, think of them as mini pumps, and all day long they suck in water, nutrients, and oxygen in and out and in and out, and there's a natural ebb and flow, and that's helped to by movement. But when the disc breaks down, that pumping action slows down or stops or doesn't really do a good job, and the discs start to collapse. And all the stability and strength in your back, it disappears.
Now, and the one question I have, and which I had when I did come to you, Dr. Schisler, was that, well, I did traction. So where they kind of were pulling me, and it was worse. Like, I would leave crying. I'd cry for 8 hours, and then I couldn't move for 3 days. And because whatever it was doing to me was making it so much worse. Mm-hmm. And it seems like this is what the machine does as well, but it's something completely different.
It is, and it's a difficult thing to understand. When you first think of traction, you think, well, hey, that's a good idea. Let's pull these things apart. The big difficulty that we have with traction is that, well, it doesn't really work. And the reason why has to do with some muscle physiology. In every muscle, there are certain nerve receptors called stretch receptors, and their job is to protect the muscle. So when a muscle gets stretched out, it has a natural length, and beyond that, well, then it takes damage. Well, the stretch receptors are there to sense when the muscle's being stretched beyond that point where it's safe, and then they contract the muscle, and that way preserving it. Well, when you're having traction, that will set off the stretch receptor, and unfortunately, it's not enough time for a specific vacuum in the disc space to be formed, which does suck the disc material back. So what can happen is that muscle, which is already strained and already trying to protect an area that's damaged, will contract and aggravate things, making that site of injury, well, hurt more. Mm-hmm. What the DRX 9000 does is it bypasses those stretch receptors and keeps everything very, very relaxed. So we can properly create a vacuum in the disc space itself that, again, does the job.
And it makes so much sense. You're sucking the disc space back, like the disc back into the disc space, so you no longer have it sitting on the nerve root.
Yeah.